Hi, I'm Tony of Tony 10-Speed. In this video we'll be looking at the relief of neck and upper shoulder pain using a Thera Cane, a device for applying pressure to trigger points. For a general description of a Thera Cane, see one of our previous videos. The Levator Scapulae, which has its roots in the Latin word elevator, attaches to the upper portion of the shoulder blade and extends to the upper 4 vertebrae of the neck. It assists in raising the shoulders and turning the head to the same side, and steadies the head against any forward movement. There are 3 trigger points on each side of the neck that refer pain along the neck or the shoulder, or when one turns their head, let's say to look for a car in the back. Palpate along the muscle and feel for trigger points or muscle knots. The middle trigger point is located right towards the top of the scapula, and you can use a Theracane if you find a knot to apply some pressure. Pull down with both hands and then move your right hand outward to apply pressure. Do this for about 20 or 30 seconds to see if you can get that knot to release. You can then move the Theracane down to the lowest trigger point or muscle knot if you have one, and again apply pressure, pulling down with both hands and outward with the lower. To apply pressure to the top trigger point, if you have a muscle knot or pain, you can use the handle directly on that knot, again applying pressure 15-20 seconds, or you can use the base of your thumb to apply pressure to that point. You're better off doing this for short intervals several times a day, with the hope that you'll relieve that muscle knot or trigger points over the course of a few days. The Trapezius is a Greek word for small plate. It attaches to the base of the skull, shoulder and collarbone, and down along the spine. Its function is to move the shoulders, support the weight of the shoulders, and to rotate the arms as you raise them. There are 4 more trigger points, and we'll talk about the first 2 that relate to neck pain, and we'll talk about some of the other trigger points in the trapezius relating to back pain in another video. Point 1 is located where the shoulder joins to the neck and can result in neck pain, templar headaches, and even lower jaw pain. Point 2, actually 2 points that are about an inch or so apart in the deep roll of the muscle at the top of the shoulder, and can result in pain at the base of the skull, neck pain, and even headaches. palpate the area with your fingers along the top of the scapula until you find any tender points, knots, what we call trigger points. Then, using the Theracane, apply pressure to that point by pulling down with both hands. To apply a little more pressure, you can move the lower hand outward a little bit and pull down. And you do this approximately 15 to 20 seconds. And then move to any other muscle knots or trigger points that you have found when you've palpated that area and repeat the process. Repeating this several times a day, you'll get better results than prolonged pressure on that point. For more information, go to tony10speed.com, where we discuss this in further details as well as the causes of these problems.